Hi folks, Dr. Craig Steingraber here. Part of our chronic pain series here. We talked about chronic back pain the last video, but as I mentioned in that video too, it really doesn't have to be back pain. Most chronic pain, it's not because of a pinched nerve somewhere. There's many different factors that play into it. This is just one of the more common factors, and so let's talk about that. So we talked about activating or improving how the nervous system functions, the pain processing system of our nervous system. And we have to improve that so we feel better. And there's a lot of things to do. This is one of them. So we're going to talk about the peripheral. This is outside of the central nervous system and in the peripheral nervous system. And one aspect of potential chronic pain production is this. And let's go to our anatomy and neurology class here. So we have a bone. Looks like one, doesn't it? Another bone. We have this black line signifies a ligament. This little line and this little line signifies a tendon, and this is a muscle. These tendons and ligaments attach to the bones. Now, in these muscles, tendons, and ligaments, we have this red lines of signifying pain nerves. So they're pain nerves, and the nerve signals that travel along there come out of those respective bits of anatomy, go into our spinal cord, up to a region of our brain where we feel an ouch. There can be one of the reflexes of that is that will touch base or communicate with another region of the brain that causes muscles and tendons to tighten and loosen. So it'll send this reflex nerve signaling along these respective nerves back out to tendons and muscles only to create different tension or relaxation or looseness or whatever term we want to use. Now, within these ligaments, within these muscles and tendons, we can get scar tissue. It's also called fibrosis. And these are a little picture. For instance, we want to have these fibers in parallel within the muscles and the tendons and the ligaments. Scar tissue is like a plaid shirt. It's not in parallel. We got to break that down as much as we can, and there's a lot of different ways to do that. We'll talk about that in the next session. How does this happen? It happens in everybody, everyone. Old injuries, repetitive motions, sustained postures, gravity. You getting away from that anytime soon? It's life, and we have to learn how to manage these different components, manage the production of this, manage how all this neurology works to feel better. It's a very important thing to do, and we can help you with that. We'll see you next week.